Role and Responsibilities of Community and Public Health by Amy Smith. Community and public health are a vital part of the well-being of our local, state, and national populations. Health, diet, wellness, prevention, disease control, disease treatment, and emergency response and preparedness make up just a few of the areas addressed by community and public health professionals and agencies. According to Funk and Wagnall's New World Encyclopedia, public health includes 4 major areas. 1. The promotion of positive health and vitality. 2. The prevention of infectious and non-infectious disease as well as injury. 3. The organization and provision of services for diagnosis and treatment of illness. And 4. The rehabilitation of sick and disabled persons to their highest possible level of function. As this diagram shows, the role of public health covers many aspects of health and wellness within the community. Intertwined within all these roles is the study of incidence, distribution, and control of disease, or epidemiology. Public health organizations play all these roles as well as providing safety precautions, preparedness, response, and recovery. Community and public health has 3 main core functions. Within these functions are 10 essential services used to fulfill the core functions. Within the function of assessment are the services of monitoring as well as diagnosing and investigating. Public health organizations monitor the community to identify health problems and then diagnose and investigate them. The second function is policy development. Within this function, public health organizations work to educate, empower, and inform the public about health issues. They also work to mobilize community partnerships and support individual and community health efforts by developing policies and plans. The final function of public health is assurance. Within this function are the essential services of enforcing laws and regulations that protect the community, linking people to the needed appropriate services, and assurance of a competent healthcare workforce. The final services within the assurance function are evaluating quality, effectiveness, and accessibility, and finally researching for new solutions and innovations. The public health system in America is led by the United States Department of Health and Human Services, or the USDHHS. This is the government's head agency for providing services and ensuring the health of the United States. The USDHHS is made up of many organizations that are each broken up into many more agencies within themselves. Made up of 27 separate health centers and institutes, the National Institute of Health, the NIH, is charged with medical research for the nation and works as one of many parts of the USDHHS. The Food and Drug Administration works to ensure medical devices and pharmaceuticals are working adequately and specializes in food safety and cosmetic safety. The CDC, or Center for Disease Control and Prevention, works as part of the Department of Health and Human Services by handling health surveillance, disease prevention, monitors outbreaks, and maintains national health statistics. The Indian Health Services provides health services through hospitals, health centers, and urban health programs. The Health Resources and Services Administration provides uninsured, low-income people and those that live where health care is scarce to access to health services. The SAMHSA, or Substance Abuse and Mental Health Services Administration, works to treat, educate, and prevent substance abuse and mental health problems. Finally, the Agency for Healthcare Research and Quality supports research on healthcare systems and quality, cost, assess, and effectiveness of medical treatments. All of these organizations depend on funding through the federal government. According to the CDC, public health ethics involves a systematic process to clarify, prioritize, and justify possible courses of public health action based on ethical principles, values, and beliefs of stakeholders, and scientific and other information. HIPAA, or the Health Insurance Portability and Accountability Act, provides patients with protection of privacy of medical records. It also gives patients the right to access, use, and distribute their records, as well as the right to file complaints, designate means of communication with providers, and allows patients the right to non-disclosure of records to family members. Another ethical issue that must be addressed in public and community health is the rights to the society versus protecting the rights of individuals. This issue comes into play when contagious diseases or outbreaks must be addressed while keeping individual rights protected. Communication plays a major role in public and community health. Not only is communication between patient and provider important, but the provider must have communication with local health agencies. These agencies then have access to reach out to the appropriate means in case of outbreak of infectious or chronic disease. Research agencies use the information gathered through communication to assure that the proper policies and actions are taken to assure the well-being of health of the public. Thank you.